Right. Welcome everyone to another virtual shadowing session at Hearts for Health. We saw quite a few of you last session, just yesterday. We have back-to-back sessions. This is not always the case, but we're excited to bring back-to-back sessions to you today. By the way, just for those who might be wondering, we typically have our sessions on Mondays and Thursdays, but if there are any schedule changes, we do let everyone know through our Instagram page and our listserv. But today we're joined by Dr. Judy. She's a pediatric dentist. We have had pediatric dentistry a couple of times now, and we're pretty excited to have Dr. Judy on to talk about it. So Dr. Judy practices right now in sunny California. She'll talk a little more about herself, about her journey, and we'll see some exciting patient cases later on. I do have a few reminders though for those who are listening. And as always, feel free to reach out with any questions. I'll give our email later on through these reminders. But my first thing I wanted to state is, for those who are new, who are not very familiar with our shadowing sessions, we do have a Q&A at the end of each of these sessions. So if you do have any questions for us, or if you have any questions more specifically for Dr. Judy, I should say, definitely feel free to type them in the chat. At the very end of today's session, I will read them out to Dr. Judy, and we'll go through them in the order that we receive them. So be sure to just write out any questions that you have, and we'll go through them later on during the session. For those who want to stay updated with future shadowing sessions, we have two ways you can go about that. We have our Instagram page and we have our email listserv. Our listserv is something that we send out weekly. That includes flyers, just like you would see on Instagram, and that's how you most likely will have learned about this session. But that listserv will include flyers, like I said, and possibly some other opportunities. Outside of our shadowing program, we have expanded to have a mentorship program. We have a few volunteering programs. So we do post those on our Instagram page, and we recently did, especially this past month. And we also do the same on our email listserv. So two ways that you can get in tune with us. In order to get onto that email listserv, you can either go onto our web page, our website, I should say, go to any of the pages, doesn't really matter. At the very end of any of those pages, you'll see a subscription form on the left-hand side. Fill it out, click submit, and you'll be good to go. Or you can email us at shadowing.h4h@gmail.com. Ask to be added to our listserv, and you will be added on. Those are two ways to go about it. You can also email us at that email for any questions you might have. We'll get back to you as soon as we can. But really, that's all. I'll have some reminders at the very end of today's session in terms of our quiz. If you're not familiar with us, we do have a quiz, and that will be gathered together at the end of the presentation today. We will post it in the chat. So stay tuned. But with that, I don't want to take up too much time. So Dr. Judy, feel free to take it away.
Thank you so much, Michael. I am so happy to be here. Yeah, I'm just going to go ahead and start. We have a lot to go through. So these are the topics I'll be covering today. So I just want to kind of go through it. I'm going to talk a little bit about myself and my road towards pediatric dentistry. I'm going to talk a little bit about the application process and some interview tips, as well as choosing a specialty. And then we're going to go through a typical day of what you can expect as a pediatric dentist. And then we're going to go through some clinical cases. I'm going to go through some of the most common emergency cases that I see as a pediatric dentist. And then I think the highlight of my presentation is what they don't tell you about pediatric dentists. I feel like they don't really advertise this or tell you this unless you really know a pediatric dentist yourself, who can kind of get like up close and personal and tell you what it's really about, the good, the bad, everything. Okay. And then, like Michael said, we're going to do some Q&As if you guys have any questions. So let's get going. So I am a board certified pediatric dentist. I am based in Southern California, and I've been out practicing for a little over 3 years. I do work at a high volume private practice, which means, when you see kids, automatically you're going to see way more than, say, for example, a general dentist or any other specialty. But my particular practice is very high volume, which means I can see up to, on a slow day, maybe 50 patients, on a really busy day during the summer, up to 100. And I know it sounds crazy, but I promise it's doable. But I'll go a little bit into that later. So my road to dentistry, I'm just going to show you kind of a little roadmap. So I went to undergrad at UC San Diego. So that's just, undergraduate college. For 4 years, I majored in human biology with an emphasis on, I was actually pre-med for all of 4 years, all throughout. I was like on that track. I took the MCAT and everything. And right before I was about to graduate, I decided, wait, I don't think this is what I want to do. So I actually just kind of tossed that to the side and took a gap year. I didn't know it was going to be 2 years, but it ended up being 2 years where I kind of really explored what I wanted to do. And in the meantime, I worked multiple part-time jobs. It was actually a really fun time in my life because, you are in school for, from kindergarten all the way to college. And this is the first time you really have like a break from school. And it really allows you to kind of like refresh and think about what you actually want to do. And that time off allowed me to really hone in on the fact that I want to pursue dentistry. So during the gap years, obviously it's a fun time, but you also want to show in those years that you're working towards something, especially if you're going to apply to some type of professional school. So I did, throughout those 2 years, I did shadow at a pediatric dental office. And then during those gap years, I applied for dental school. I took the DATs, and then I ended up at UCLA. So dental school is 4 years. And after those 4 years, you are a dentist. You are equipped to go out in the real world and see patients. There's always an option to specialize like I did. And in dentistry, there's a whole bunch of specialties ranging from an additional 1 year all the way up to 6 years. And, anything as there's orthodontics where you do braces, there's oral surgery where you take out wisdom teeth or you do a lot of orthodontic surgery. But I chose pediatric dentist, which is a 2-year program. So I did mention at UCLA, a public versus private. So if you guys are considering any type of extra schooling, it's very important. I think looking back, as a student, as an applicant, your main goal is just to get in any school, but obviously you'll have choices, right? You'll be accepted to hopefully many different schools. And one thing I always tell students is to really consider the financial aspects of which school you go to. Obviously, if you go to a public school, the tuition is a lot more affordable than versus a private school. So a lot of people don't think about that necessarily. I know I didn't as much because you just want to go to the top school, right? The best school that there is. But at the end of the day, when you think about it, no matter what school you graduated from, we're all going to end up in the same place. We're all going to be practicing dentistry. So what you end up with as a dentist is a whole bunch of loans. Everyone's at the same place. We're all dentists, but then depending on what school you go to, you might have to pay back more hefty loan than others. So I do recommend, anytime someone asks me for advice, to really consider the tuition and see if you are fortunate enough to get a scholarship and that kind of lessens your tuition, consider those schools as well. So that's like my little spiel with dental school. So, and then in terms of, in dental school, you have the luxury of picking which school you want to go to. Now, as you progress to residency, you don't have that luxury because residency is what we call a match program, where you go to all these interviews and then a system kind of matches you up with the school that kind of ranks you the same. And we'll go into that later. But that's one thing. Another thing to consider is that, for residency, there's 2 different programs. One is didactic versus a hospital-based. So didactic just means that it's a very research-based school. So what you can expect from a program like that is a lot of, research-based. So they're probably looking for people with research experience during your undergrad or gap year or any time prior to the residency. And then it's more of, getting into the literature of things, knowing what materials are best, looking into studies of like which materials and, the way we practice dentistry versus a hospital-based, there's a blend of each, but hospital-based school is where the program is tied to a hospital. So you're expected to see one, you're on call, so you work directly with the hospital, and you have depending on your program, weeks that you're on call where you get a pager, and you might get paged in the middle of the night, and you're expected to see a patient who had maybe trauma or something related to dentistry that you can take care of at the hospital. Now, and then there's a blend of both, a little of both. So you really need to kind of do your research, ask people who have been to those programs what kind of school and what kind of program you're specifically looking for, and make sure that matches. Because, you know, me personally, I had zero interest in research. I didn't have much research experience, and I know I didn't want to go to a research-based school, which kind of allowed me to kind of hone in on which schools I actually wanted to apply for. And, you know, a lot of people, the goal is just wanting to get in, but I also think it's very important to know that, you know, you're interviewing a school as much as they're interviewing you. You want to make sure it's a right match. So you really got to be honest with yourself and see like if that program is tailored towards you, and not think so much about, you know, the name of the school. And then as with any program, I think, again, the financial aspect is very important. So there are programs where you have to pay to be a resident, or there's programs where you get paid to be a resident. So obviously I went for the school that paid me, because financially at the end of the day, we're all going to be pediatric dentists, we're all going to be dentists. So why not go for a program that actually pays you? So that was kind of my road towards dentistry. And like I said, I'm 3.5 years out of residency, and we'll go into kind of what it's like as a pediatric dentist later. So some application interview tips. I think I kind of jumped the gun on that, but I did discuss a little bit of that. But okay, to be honest, I've been out of the game for a while now, so take what I say with a grain of salt. I think the best advice are people who literally just finished like the application cycle, who have like kind of, you know, things constantly change. So this is what I'm talking to you about, is what I personally experienced. I don't know if anything has changed since then, but my biggest advice to you is talk to someone who recently went through dental school interviews or residency interviews, so that you have kind of like up-to-date information. But when I was applying for dental school, obviously your DAT scores matter. That's kind of what the schools look for initially to weed them out. You know, they have tons and tons, thousands and thousands of applicants, and they want to kind of limit how many applications they actually read. They're not going to read every single one. And the first thing they look at are the numbers. So your DAT score, it's very, very important. And I would recommend, you know, to take it multiple times until you're happy with the number. I think I took it twice until I was happy, and there's no shame in taking it multiple times. You want to have a very strong application or very strong numbers to begin with. So I would recommend taking it as many times as you want. And then obviously you want to show the schools that you have an interest in it. So, you know, I shadowed at a pediatric dental office, and it can be anything. You can shadow, you can work, just any type of experience to show that you really thought about this and you really know what it's going to be like. Because the last thing they want is for you to realize midway into school that you're like, wait, this is not what I want to do. And then the dental, like I said, I briefly touched upon this, but with dental schools, the good thing is you can send out as many applications as you want. And then, you know, obviously to increase your chances, you can send out 100 or so, and whatever acceptances you get, you can choose from those acceptances where you eventually want to go. Now, going into residency, one of the biggest tips that I can give people for residency programs is to network and, you know, stay in touch with your dental school colleagues, stay in touch with people who have helped you along the way, and really like, don't forget the people who helped you. And, you know, if someone helped you during, when you were an undergrad to get into dental school, keep in touch with those people, because you never know, you know, keep them updated, like send them an email during the holidays and say, hey, I'm in my first year of dental school. It's going great. Thank you for your help. Just have a network of people around you. So when you get to any stage, you have people kind of all throughout, and you'll find that as you go higher into like the dental world, that actually the dental community is actually really small. So you want to build these great connections, because in the end, we all end up helping each other out. So in terms of residency, a big part of the residency applicate, or I guess interview, is just knowing people, right? So I had dental school friends who are like, when I was in dental school, I had people who were higher up than me. So I was a first year and I made friends with second, third, and fourth years. And by the time you're applying, they're already in the program, and you can really reach out to these people and ask about the programs. And they might even put in a good word for you, and that might increase your chances of getting an in-person interview. So with residency, you actually have to go in person and interview with them. So again, it's a formal application where you electronically send it to them. But once they feel like they want to meet you in person, there's an interview season where you fly out to all these schools and you just really meet the people who are currently in the program. You meet other people who are in the same position as you, who might be your co-residents at the end of the day. And you really get to know the program and the people around it. Now, another big tip is internships. When you're in dental school, if you know that you're into a special, that you want to apply for a residency, some people take their summer, the time that they have off of dental school, whether it's spring break, winter vacation, whatever time they have off, and they reach out to certain schools for what they call an internship. And most programs have an internship where you're it can be a 1-day shadowing, it can be 3 days, it can be a full week, where you really just hang out with the current residents. And that, again, is another form of networking. Say, for example, if there's a school or program that you really want to go to, but you don't know anyone personally that you can kind of ask how the program is, I would recommend doing an internship. Now, internships it's kind of like a double-edged sword, right? Like, when you go, it's great because you meet people, but you can really mess up your chances of getting an application if you're just not the right fit, right? If you're just a fly on the wall and you just don't talk to anyone and you're just observing, that's not going to benefit you, and it's not going to make the current residents want you to be part of their program. So you really have to have a fine line between, making sure your personality shows, but not, at the end of the day, they're there to do a job and they can't baby you. Like, you can have questions, but at some point you don't want to be a burden where they're seeing patients, but they have to answer your questions. So it's a very, very fine line. So I always say, if you do an internship, make sure you're prepared to kind of, network and get to know them, but don't be in their way, Because I've definitely been on that end where when I was a resident, we had interns and I really got to see both sides of it. So that's why I think that's the biggest tip. If you do an internship, know that it can work. It can definitely help you get an interview, but it can actually work against you as well. So keep that in mind. And then personality, if you're at the point where you're getting an in-person interview, that's great. That means you're great on paper, but what the in-person interview actually lets them know is this someone that I want to work with? Is this a team player? Am I going to be able to depend on this person because they're going to be my co-resident to maybe, if I had an emergency, to cover me or be helpful? Like, if they finish early with a patient, will they help me if I'm running behind? So that's what we're kind of looking for when you step into the in-person interview. So personality is very, very important. Now, you don't want to pretend like you're someone you're not, but at the same time, you want to show and highlight that you're a team player. And then, like I mentioned before, with residencies, you don't get the luxury of, picking which school you want to go to. It's a match program, and it's a really scary process because there's some great applicants who you're like, oh, for sure they're going to get in, but somewhere along the lines with that computer program, the match system, you might not get matched, and that's okay. There's always the next year, but with the match program, it's a ranking system. So you rank the schools that you want to go to from 1 one being your top choice, all the way down to however many interviews you got. And the school in terms ranks you out of all the people that they've interviewed that season. And then the computer just does this formula, and then you get matched or you don't. Okay. So it's really scary because, like I said, there's some great applicants who don't get matched, and it doesn't mean that they're not a good applicant. It just means that maybe something along the line, maybe they didn't pick schools that was in line with what they were looking for. So that's why I say it's very important to know what you're looking for, because if you go to an interview and you go to a school where their strength is research, and then they ask you, oh, how do you feel about research? And you're like, oh, I haven't done any research. They're gonna be like, why are you here? So that's why it's like I said, you're interviewing the school as much as they're interviewing you. And that's what match kind of really highlights. So you really want to kind of be in line with the formula. Otherwise, it's going to work against you. Okay, moving on, choosing a specialty. So once you're in dental school, like I said, there are, I believe, oh, don't quote me on this, but I think 6 or 7 recognized specialty in dentistry. Now there's always other ones, but they're not officially recognized, but they're still very specialized field of dentistry. So my advice is always just to stay open, while you're in dental school, like don't pigeonhole yourself into one thing. Like, for example, although I shadowed a pediatric dentist and I had an inkling I might specialize in that, I wanted to make sure that I explored everything in case I like something more than pediatric dentistry. So don't pigeonhole yourself. It's okay if you join like the pediatric club, the oral surgery club, anything. So I recommend spending your first year just to kind of get a feel of everything. And in dental school, if you have the program usually exposes you to every specialty because you eventually rotate around. But I think it's actually more advantageous to do that early on and not wait for your rotations, because rotations don't usually come until like your 3rd year. And by then, like everyone already has picked their specialty, and that's when most people apply. So I would say stay open-minded. But even though I say start early, it doesn't mean that you can't be working towards, like, say, for example, 1st and 2nd year, you're like, I want to do pediatric dentistry. And then 3rd year, like, wait, I actually want to do oral surgery. Don't be afraid to switch last minute. Like you're going to feel behind, but don't let that stop you, because this is the best time to kind of like realize that, okay, that's not what I want to do. Because once you're in a program, you're kind of like in it, right? So dental school is the time to kind of explore and like be open-minded. And then, like I said, it's very important to talk to people in that field. So it's knowing someone who is already where you want to be. Say, for example, if you're a dental student and you want to be a pediatric dentist, find a mentor and like find someone who that can really tell you what it's like, because in dental school, they just kind of teach you what you're going to be doing as like a dentist, but they don't tell you actually what it is. And that's the end of my presentation, where I kind of really go in and tell you things that they don't really talk about or teach you in dental school. Okay, so now we're going to hone in on pediatric dentistry as a whole. Okay, so what can you expect a typical day as a pediatric dentist to look like? So in general, as a dentist, the beauty of being a dentist is you can create your own schedule. You can work as much as you want. And most dentists, unless you're owning, most dentists work at multiple practices. Okay. And most dentists kind of hop around. Like it's not taboo to kind of work one place for like a couple months and realize that it's not a good fit and then jump around. But, keep in mind the dental community is very small, so you don't want to burn any bridges. But I know like in maybe like other corporate world, it looks taboo to kind of jump around in such a short amount of time. But in dentistry, it's kind of common. So don't be afraid to kind of do that. So yeah, and you can be a part-time dentist, you can be a full-time dentist, you can work at multiple offices, you can work at one office. It's very flexible, and which is what I love about dentistry in general. So this is my typical work week, and every dentist you talk to has a very different schedule. So I was fortunate enough to work 4 days a week, but still be considered full-time. As you can see, my Monday and Wednesdays, I work 10-hour shifts. And then my Tuesday, Thursdays are a typical 8-hour shift, which leads me to 36 hours a week. The normal work week is 40 hours a week. So luckily for me, I'm considered still full-time. And then every week I get a 3-day weekend, and it's amazing. So like I said, every dentist schedule is different, and I'm really happy with my schedule. So you can tailor it any way you want. So a typical day as a pediatric dentist, like I mentioned before, I work at a very high volume practice, which means, 50 to 75 patients a day, up to 100 in the summer when the kids are out at school. And the bread and butter of pediatric dentistry is what we call recall appointments. And recall is just a fancy way of saying cleaning appointments. You go to your cleaning appointments twice a year, every 6 months. And that's a big chunk of my day, is just looking at x-rays, making sure kids don't have any cavities. If they do have cavities, we talk to the parents about the treatment, and then we bring them back for treatment. I would say 70% of my day is doing just looking at x-rays and diagnosing and treatment planning. And then there's treatment appointments where kids have already been diagnosed and I know that they need treatment. And that's when I do fillings, crowns, or extractions, whatever they need. So like I said, 70 to 75% recall appointments, and then 25% treatment days. Treatment patients. And then there's I call them special days, but it depends on your office and whether your office offers this. But special days can be like in-office sedation, which I do twice a month, which is general anesthesia. With pediatric dentistry, we have a lot of, kids who are just not at the age where they can kind of tolerate treatment in the chair. So sometimes they have a mouthful of cavities, but they're too young to kind of like go through treatment awake. So what we end up having to do is treatment under general anesthesia. We work with an anesthesiologist. They're nice and comfortably asleep. And then I can do all the dentistry. And those days, like I said, depends on your office. Some people do in-office sedation. Some people do hospital dentistry in the OR, which is essentially the same thing. They're under general anesthesia, but the setting is different. It's not in your clinic at the dental office, but in the OR at a hospital. And then I don't personally do this, but a lot of my colleagues are faculty at dental schools. So whether they like teaching or they want to be a faculty in the future, you can, as a dentist, you can volunteer to be either a part-time or a full-time faculty at a dental school. So that's one of the cool things with dentistry that not a lot of people talk about. They think we're just, you're just kind of seeing patients, but you can be a full-time faculty, you can do full-time OR, you can be a full-time GA doctor, or you can do a little of hybrid, a mix of a little of everything. So this is why I mentioned earlier, recall appointments, 75 of your day. What you're doing is, you see this picture here. This is what for younger kids, this is what we call like a knee-to-knee exam. And we're just looking at x-rays and diagnosing. We're educating, we're seeing if parents need some anticipatory guidance as to like what to expect for their first child. A lot of new parents don't know how to take care of their children's teeth. So we do a lot of educating. And that's a big component of pediatric dentistry, because their kids, we focus more on the preventative. We really teach parents and children and how they can work together to build good oral habits early on. So you'll do a lot of talking, you'll repeat yourself a lot, but education is very, very important in pediatric dentistry and in all aspects of dentistry, but specifically in pediatric dentistry, because we want to kind of instill these good behaviors or habits early on. Okay, and then when I talk about treatment appointments, this is the type of treatment that we do. So 25% of my day is doing treatment on children. And you'll see this pink little nose. This is what we call the nitrous oxide. It's the laughing gas. And surprisingly enough, it doesn't really make kids laugh. Like I think it's like a misnomer, but some kids laugh, but then most of the time it just helps relax them and get them through like the anxiety if they have any. And in children's dentistry, we do our bread and butter are like just typical white color fillings, crowns, baby root canals, or extractions. Nothing fancy. Those 4 procedures is kind of like what we do. Now there's also like space maintainers and everything like that, but this is typically what we do. And then I was talking about the special days. So this just going into a little bit of each. In-office sedation, like I said, you work with an anesthesiologist. You as the dentist never does the sedation. You need someone there to strictly just focus on monitoring the vitals while the dentist works on the dental aspect. So I like it because, in pediatric dentistry, a lot of the time is spent not actually doing the dentistry, it's actually behavioral management, like talking to kids, showing them everything so they're not nervous. So a lot of that, I would say, in my personal opinion, pediatric dentistry is 70% behavioral management and 30% of actually doing the work, because, the skills, it's like, by the time you do your 100th filling, it's all the same, right? You can do it with your eyes closed, but what is variable from day to day and patient to patient is the child's behavior, okay? And that's kind of what keeps you on your toes. So in a day like general anesthesia, it's kind of nice to have a break from that, where everything's just nice and quiet and you just focus 100% on the dentistry. So, and another aspect that I love about general anesthesia days is that you get to really work with another provider. So that multi-specialty, as a dentist, it's a very solitary, you're the doctor, you're the only doctor there. So you don't, other than your assistants, you're kind of like the go-to person. But on a day with general anesthesia, I get to kind of talk to my colleagues and, see another type of specialty do their job along with me. So it's kind of cool that you get to work with other specialties. And then, like I said, there's hospital dentistry, for children who are medically compromised, where it's a little too risky to do in-office sedation. We usually refer them to do general anesthesia in the OR. That's because in a hospital setting, if anything goes wrong, they have the equipment there just in case anything happens. So it's a lot safer. When working with kids, we want to be more than cautious, right? So we want to plan ahead and make sure everything goes accordingly. So if we see that there's a little chance that a child has a higher risk, then we would recommend that they be seen in a hospital setting. And then, like I talked about, you can be a faculty at a dental school where you can teach dental students, and sometimes it's paid, sometimes you're just volunteering your time. So that's also another option. Okay, so we're gonna go into some pediatric clinical cases, and these are the top 3 that I see on a daily basis, probably multiple times a day. People come in for the same things. Okay, so case 1, we have the shark teeth. So a parent comes in and they're like, oh, my son has teeth growing behind another teeth. And they always call it shark teeth because there's rows and rows of teeth. I guess sharks have rows of teeth. I did not know that. I was wondering why they kept calling it shark teeth. But so why does this happen, right? Let's see. So this is what we call in dental terms ectopic eruption. Basically, if a tooth is erupting in a position where it normally doesn't erupt, we call it ectopic. And, what makes the tooth loose is the fact that the adult tooth is pushing up and dissolving the root of the baby tooth. And that's when it becomes kind of loose and wiggly. But if it's growing not in the right position and it grows behind it, nothing is making the baby tooth loose. So what you end up having is these 2 rows of teeth, because the adult teeth are ready to grow in, but the baby teeth, they're not dissolving the root of the baby teeth. So the baby teeth are just rigidly there. So, so what do we tell parents to do? What happens in this case? Do we have to pull out the tooth, or what's the next step? So 2 options here. So sometimes if the tooth is close enough to if the adult tooth right here is close enough to the baby tooth, it ends up dissolving the partial root and you still have a wiggly tooth. And in those cases, in pediatric dentistry, we don't look at just the teeth. We look at the overall picture. And if we can avoid treatment on a child, I always try to avoid it, because what you don't want to end up doing is traumatizing them and putting them through treatment if it's not necessary. So I'm a little bit conservative in that sense. So I always try to avoid treatment if I can, just because, you want to delay for me personally, I believe that it's best to delay treatment when the child is a lot older and can kind of deal with those type of stresses. If you're trying to do treatment early on, you can run the risk of kind of like traumatizing them early on. And in the back of my head, that's like my number one thing. I never want to traumatize a child. So in these cases, if it's already loose and wiggly, I always encourage the parents to help the child wiggle it back and forth. What you want to see is progress. You want to see the tooth becoming more loose, and sooner or later, the tooth will just fall out. And then the next question the parents always ask is that adult tooth going to stay in that position? I don't want the tooth to like be growing behind. What happens is once the baby tooth is out, what the natural force of the tongue will push the adult tooth forward, and in a matter of weeks, it'll be like nothing happened. And then parents are always so surprised how much it gets pushed out to the natural position. So the goal of this is just to get the baby tooth out so that the adult tooth can push forward where it needs to be. And then there are some cases, like I said, where the adult, where the adult tooth is so far back that the baby tooth is not even budging. It's not even loose at all. And that's when I know, okay, I'm going to have to go in and help them and do an extraction. So those are the two options. If I see it's already loose, I just tell parents just to wiggle it out. And I always ask the kids, I'm like, do you want me to do it? Or do you want your mommy, daddy to do it? And like 9 out of 10 times they're like mommy and daddy, because they don't want a tooth pulled out, you know? So, and most of the time it's fine. The next time I see them, parents are like, oh yeah, it looks great. But it's amazing how much the adult tooth moves. So that's the number one case that I see, shark teeth. And then the next case I see is a random case of a tooth turning gray. So I have a parent comes in, they're like, wait, my daughter's tooth randomly just turned gray out of nowhere. And you can kind of see that this tooth in the middle here is a little discolored compared to the other teeth right next to it. So what happened? So tooth discoloration, so post-trauma, that means that, kids, when they're starting to learn how to walk, or in their toddler years, or even up to like adult adolescence, when they're playing sports, tooth trauma is very, very common. Either like they banged a toy on their tooth, they fell down, they banged their heads against their siblings. It can be anything, right? But when there's any history of trauma, it's hard to tell how severely the blood vessels, or there's blood vessels and nerves within the tooth. So it's hard to tell how much it's been damaged just by a clinical evaluation or by x-rays. So when you see this discoloration, it's actually kind of like, when you have a bruise on your skin, it turns a little purple. Same thing with the tooth. It turns this grayish color, and that's actually the blood vessels that were damaged and causing this discoloration to show through the enamel. And sometimes I've seen it lighten back to the natural color, but most of the time it stays this discolored, like gray color, and it's going to stay that color until that tooth falls out. Now, the discoloration, I always tell parents, it doesn't mean anything. It doesn't mean the tooth is dead. It doesn't mean that it's a higher chance of getting an infection. It's just a little it's just a little discoloration. But as with any tooth trauma, we always want to follow up long-term and make sure there's no signs of infection. And that's the most important thing. So tooth discoloration in and of itself is totally fine. We just kind of monitor it and make sure there's no signs of infection. So like I said, no treatment needed for discoloration, very common in toddlers who are just beginning to learn to like walk, or like rough housing with their siblings. And like I said, follow-up is necessary for any signs of infection. But again, the discoloration itself doesn't mean that the tooth will be infected or is infected. Okay, the next thing we see is parent comes in and says, my son has this big bump on their tooth, or like I've noticed that their face is a little bit swollen. So you just by looking at the patient, you kind of just see the patient's right cheek is a little bit more puffy than the left cheek. And then when you look inside the mouth, you see this big old swelling right here. So what can that be? So this is actually what we call a tooth abscess. Okay, it's a pus that forms. So basically, you see this most common. Let me see if the picture shows in. You can't really see, but if you look at the tooth itself, you see that little like shadow, that gray. So that's probably cavities that are deep, that ran really deep into the nerve. So as you see here in the diagram, this black thing is a cavity, and a small cavity goes through the enamel, and then a large cavity goes through the dentin, and then a very deep cavity that can potentially cause a tooth abscess goes straight into the pulp. And like I said, the pulp is filled with nerves, blood vessels, everything there. And if the cavity goes all the way down and travels down the nerve, what you start to see is an abscess. And the abscess occurs because the tooth is essentially dead. The body knows that the tooth is dead and automatically wants to reject this tooth and get it out of the system, right? So that's where you see this abscess, okay? And along with this, you see a lot of bone loss because, again, the body's bone is what's holding the tooth, and the body's trying to get rid of that. So you see a lot of bone destruction, and you even see the tooth becoming loose. So these can be potentially very life-threatening because, especially in a child, because depending on where they're getting the abscess, the swelling can get so big that sometimes it can travel up to the eye and their nose area. And if they have a swelling there, it could potentially compromise their airway and they can have trouble breathing. So we never want, any cavity to get to this point, but it happens sometimes, So whenever we see an abscess, we want to contain the infection. And let me go to the next. So what are the treatment options? Anytime there's an anytime there's an infection, we got to get rid of that tooth. There's two options. One is to extract the tooth completely. If there's not enough tooth structure to even hold a crown to save the tooth, most likely we have to extract. There's another option where we do kind of like a baby root canal where we clean out all the nerves. But again, if there's no tooth to hold the filling, then we have no choice but to extract the tooth. Now, sometimes when there's a big swelling, sometimes you can have that bump without a swelling, but when we see the swelling, that's when you really want to make sure that it doesn't progress. So anytime I see an abscess, I prescribe antibiotics, and most people think that antibiotics will cure the infection, but that's totally not what the antibiotics is prescribed for. It's basically prescribed so that it doesn't spread to other areas of the face. So if we see a little bump on the gums, I usually like to prescribe antibiotics just to prevent the child from waking up one day with a big swelling if we can't extract that tooth immediately on the same day. So the antibiotics is just an extra insurance to make sure that if we can't extract the tooth on the same day, that they don't wake up with a big swelling that could potentially compromise their airways. So I always tell parents, again, with pediatric dentistry, it's very important to educate and tell them, okay, I'm going to give you antibiotics, but it's not to cure the infection, because most parents just think, oh, I'll just have my child take the antibiotics and they don't ever have to come back to get the tooth taken out. And what you'll see is that after a month, the abscess comes back and they get a swelling and the root cause doesn't really get treated. So like I said, antibiotics is just a quote unquote Band-Aid to kind of help with the swelling. Yeah, so those are the top 3 cases. I hope you guys learned something or found something interesting within those cases, but I'm going to go into, what they don't tell you about pediatric dentistry. And I have a lot to say about this because it's stuff that I wish people told me before going into pediatric dentistry specifically. So what they don't tell you. So a lot of people go into pediatrics thinking like, oh, I don't like to deal with adults. So I'm just going to, I love kids. So I'm just going to do pediatric dentistry because my patients will just be kids. But one thing you don't realize is kids don't have the power of attorney to decide what's good for them. So at the end of the day, it's always, you'll always have to deal with adults because you'll have to talk to parents about the treatment plan. They're the ones that kind of sign off on the treatment. And, like I said, with education, you have to educate the child on how to brush themselves, but you also have to teach the parents how to help their child brush, right? So sometimes you are faced with difficult conversations with parents because you will see people from all types of religion, beliefs, like whatever they believe in. You will have to work with them in finding the best solution for their child. So as a dentist, you know what's best clinically for their child, but if they have different beliefs, then your job is kind of work with them. You're not trying to persuade them to do clinically what's right, but you have to come to an agreement with them on what's best for their child specifically. So, finding that balance is very difficult. And if you're someone who gets offended easily, or, you just know that it takes a lot of mental capacity to talk to these parents who have very strong beliefs. Okay. So, you can't avoid talking to parents. It comes with the territory. So yeah, your patients will be children, but you can't avoid having these difficult conversations with adults. And then another thing is, dentistry is very physically taxing. Dentistry in general, you're looking down, you're constantly sitting down, getting up, sitting down, getting up. So a lot of my colleagues have neck issues, back problems. I know I had really bad back issues like the first 2 years I was practicing. Now it's better, but it's very physically taxing. And if you are in pediatrics specifically in a high volume practice, I don't know. I want to count how many times I get up and move chairs, get up, sit down a day, because it has to be more than 100 times a day. It's very physically taxing. So you want to make sure you take care of your body, do some yoga or just do anything preventatively, because if you're having back pain, dentistry will not be fun. Because it's not going to go away. It's only going to get worse. So you really want to make sure you have good posture. You invest in things that will take care of your body so you can do dentistry in the long haul. And then, like I said, mentally tasking. Pediatric dentistry is mentally taxing. So one thing about pediatric dentistry specifically is kids really feed off your energy. So every single child I see, I act like I'm working at Disneyland. I have this happy-go-lucky, cheery voice, really really energetic. You have to be able to talk to them, interact with them, hold their attention. And kids' attention spans are 2 seconds. So you're constantly have to think of new things to talk about. And it can be very physically draining, especially my 10-hour days. When I get home, I literally cannot hold a conversation. I can't even think straight sometimes. So it's very mentally taxing. And, I've had some colleagues who didn't really consider that, because you don't really think about that. In residency and dental school, you don't see that many patients. So once you get out in the real world, you realize that, man, I've been talking nonstop all day long. It's tiring. And I've even had a colleague realize that, one, they don't like dealing with parents because they don't like just the difficulty that comes with parents. And they decided to just teach full time because they wanted to avoid that altogether. So you really have to make sure you know what you're getting into. Otherwise, it's going to be you're going to have to think of plan A, B, and C, because if you can't tolerate doing this as a 9-to-5 job. And then with pediatric dentistry, you're gonna have to get used to the screaming and crying, and you do get used to it, honestly. I just don't even I tune it out. I don't even realize that they're crying half the time. So that's something that easily you can adjust to. So what they don't tell you, continuing, you work most holidays. So with pediatric dentistry, when kids are off of school, that's when you're busiest. So winter break, which we're coming on to winter season, so we're getting really busy again. But summer is really busy. Any holidays, it's busy season for you, because parents hate taking kids out of school to go to the dentist or any type of appointment. So when you think about it, you're working, if you want to be productive, you're working most holidays when kids are off of school. Another thing they don't tell you is, the good comes with the bad, right? So the great thing about dentistry is you get to pick your own schedule, but along with that, if you're working at multiple offices, you're not considered full-time anywhere. Even if you are working those 40, even if those hours add up to a full-time position, you're not getting benefits. So that means you have to pay for your own healthcare out of pocket. And a lot of other benefits that come with a normal job. That's one thing that no one ever told me. So you want to consider that. Luckily for me, I would say I'm one of the rare cases where I actually work full-time at one office. So luckily for me, I qualify for full-time benefits, but that might be something you're considering too when you're planning your days. Maybe you do want those benefits. So maybe you will be at one office so you can qualify for those benefits. But most of my colleagues have to pay for everything out of pocket. And then like I said, with pediatric dentistry, you're educating a lot. So you'll sound like a broken record. I find myself repeating things maybe 20 times a day, and my poor assistants have to hear my spiel like over and over and over again. So it's a lot of talking. I'm probably like, I feel like I'm talking nonstop when I'm at work. So if you work at a high volume practice, that's one thing to expect. And then, like I mentioned earlier, as a pediatric dentist, your patient load automatically will be higher than other specialties. Most, don't quote me on this, but I think a general dentist maybe on a busy day sees like 10, 12 patients, but us on a busy day is like 100 patients. So keep that in mind. But again, it's doable with kids. So having said all that, in my personal opinion, obviously the good outweigh the bad. Otherwise, I wouldn't be doing this, right? So at the end of the day, I am so happy with dentistry, especially in pediatric dentistry, because working with kids, although it is tiring, they're so unpredictable and they bring like joy to your life. You never know what to expect with kids. And that's what makes life so exciting, because you never know what type of interaction you're going to get. And like I said, dentistry allows me the flexibility to have an amazing work-life balance. I don't, some days are tiring, but I don't feel exhausted. I feel like my 3-day weekends are enough. And by Monday, I'm ready. I don't get the Sunday scaries. Like, I'm ready to work on Monday. So in my personal opinion, if I had to choose again, I think I would choose dentistry, because like I said, it's what you make of it. And hopefully you guys learned something new. And I am ready for some Q&As if you guys have any. Oh, before that, I do want to say thank you again for having me. And I'm very active on social media. So, and social media, I like to kind of like uncover, like I said in this presentation, I think the most important part is to kind of like truly be transparent about what it's really like being a pediatric dentist. And in my Instagram, I do a lot of that behind the scenes, what it's really like. And I talk about some hard days. I talk about good days. So follow me if you're interested at Dr. Girlfriend, at Dr.Girlfriend on Instagram. And then I have a YouTube where I have a podcast where I talk to actually, my podcast is kind of random, so you might not find any dental related things, but I do talk to some dentists who are owners if you're interested in that. So check that out. And then if you have any other questions, if I don't get to your Q&As today, you can always email me at askdrgirlfriend@gmail.com.
Well, first of all, Dr. Judy, we really appreciate your time and getting together this beautiful presentation together. Hearing about at the very end, hearing about what they don't tell you, that was very, very insightful. I don't think that we would have ever got the chance to hear about those tips and kind of overlooked aspects of practice that people wouldn't necessarily even think about while they're busy with training. So it really, really is much appreciated.
I'm glad.
Yeah, absolutely. I mean, I'm sure that we have a lot of students out here who also learned about the training pathway. Some are freshmen, some are seniors. So I know that a lot of people, and personally myself, I took away a lot. But our first question is a little about what you discussed at the very end. How did you go about managing a social life with being in dental school and residency? Is it something that you found possible to do? Was it feasible?
Oh my God, I love that question. And I actually did a post about this yesterday. One thing that I always like emphasize, especially people in dental school is not a walk in the park. I would say I love school. I love studying. I don't mind studying, but dental school for me was the hardest 4 years of my life. Like, I have to say, like, hands down. So it's not a walk in the park. And what I am so thankful for is I realized early on that I need to maintain a good work-life balance. Otherwise, it's going to suck me in and I'm going to hate my life for 4 years. So yes, the answer is yes. It's totally feasible to have a good work-life balance, but you have to create time for that. Okay. So one thing that my rule in dental school was I refused to go in on the weekends. Like, I have colleagues who would go in, work on lab, work on dentures, work on whatever, like practice during the weekend. And to me, that wasn't worth it, because if I'm already spending all my time at school during the weekday, like, I don't want dentistry to be my life. At some point you will get burnt out. It's hard to keep up with everything. So one thing I learned is, like, what you find is that for me personally, when I was in dental school, like, yeah, you can study and get the good grade, but at the end of the day, is that what's really important? Like, what I found was that my first semester, it was really hard because I was so used to studying the way I studied in undergrad that like I was studying so much, and just I didn't have time to do normal things. And it felt like I was like in a time capsule, like that, like all my friends who are not in dental school were just living their lives. Like they were getting married, they were like going, like celebrating weddings, like going to parties. And I always was like, no, I can't go because I have to study. No, I can't go because I have to study. But then it clicked one day that I'm like, whoa, like, why am I putting my life on pause and missing out on my friends' like big events and my family life events because I have to study? There's always going to be something to study for. There's always going to be something that's going to prevent me from going. But at the end of the day, what's important? Studying for an exam where I ended up passing anyway. And I like, even if I went to my friend's wedding, so in the early on, I would say no to a lot of these things. And then I realized, wait, I can do both. I can still go to that wedding and still pass that test. I don't have to pick one over the other. And at the end of the day, like, I definitely failed some classes, but what happened? I just retook them and I'm still a dentist today, So like, when you're in that environment where your colleagues are constantly studying, all they do is studying, it's easy to just kind of be like, oh, I need to study because my peers are doing that. If I'm not doing that, I'm going to fall behind. But at the end of the day, if you create a good work-life balance, then at the end of the day, I feel like you're winning because you're still living your life and you're still going to be at the same place where your colleague is. You're still going to graduate. You're still going to pass that test. So my advice is, I know it's hard because I've been there. Like when everyone else is studying and you feel like, oh man, I shouldn't be at this wedding because I should be studying for an exam. It's really hard to break out of that. But there were a few people in my class who kind of like realized that early on. And I admire them for creating that work-life balance early on, because at the end of the day, if you do it for 4 years like that, you might get burnt out. So definitely make the time to live your life. Don't put your life on pause just because you're in dental school or residency. Continue to do those things.
Also, another quick question. This is just about what you mentioned in terms of qualifying for healthcare as a dentist. A student asking if you could just explain again. I believe it was just that you need to at least work full time, right, for the office?
It depends on your office. Some offices don't even provide that for their for their employees. So if that's something that's really important to you when you interview for a job, make sure that you clarify that. Oh, do you offer full-time benefits, and what do you consider full-time? Because my office considered 32 hours full-time, but a normal full-time is 40 hours. So you really want to make sure that's aligned if that's something you're looking for.
That's true. Yeah. Our next question is from a student asking, are people skills and the ability to comfort and talk to different kinds of individuals something that help you learn in dental school, or does it come with time?
Ooh, I think it comes with time. I feel like you don't learn that in dental school unless it's definitely not something you can teach, right? And I remember coming out when I'm practicing out in the real world. I remember when I would come across some difficult parents in the like first 6 months of working, I'm like, whoa, what do I say? Like, like I'm just kind of taken aback by like their reactions. But I do think it's something that you learn over time. Luckily, I had a good mentor. My boss is amazing. Like she'll try to she's like, this is what I would say. Like, it's good to have a mentor to kind of mentor you through that. But, 3.5 years in, like whenever like I have tough situations, nothing scares me anymore because like I said, I'm like a broken record. Like at this time, it just comes out naturally. Like, okay, this parent is going to react this way. I already know what I'm going to say. So I think you do learn it over time, but you have to like be prepared and not take anything personally. Nothing is personal. You have a job to do, and don't think that, when it comes to kids, a parent is going to be very overprotective of their kids. So you don't be surprised if you're going to kind of get some backlash because, they're parents. Like, I don't blame them. They want to protect their children. But you as a provider have to be confident in your diagnosis and confident in leading what the best treatment plan is for their child and educate them in that sense.
Absolutely, absolutely. I personally work a job at the clinic, and I can definitely relate to each part of that. How you know how to respond after a bit of time to
Mhm.
whatever backlash you might see. Um, and I'm sure some students who also might be MAs at medical, if they're medical
Exactly.
assistants,
Mhm.
hygienists, they probably catch on to that over time.
Yep.
Maybe two more questions just to wrap up this session. Our next one is from a student asking, it seems like there are a lot of people that switch from pre-med to pre-dent and vice versa. What attracted you personally to dentistry that medicine didn't have?
Yeah, that's a great question. I didn't really go into why I switched, but going into as a pre-med, I wanted to be an OBGYN. I wanted to deliver babies, and I was really, really like confident that that was like the route I wanted to go. But I don't know what in me, but like I always knew that work-life balance was very important. Growing up, I was very close to my family, and we would have family dinners every single night, and that in effect like created a really like good stable household for me to grow up in. And that's something that I knew I always wanted for my own family. And then I thought about it. I'm like, wait, if I'm going to be delivering babies, I'm going to be on call. So get calls in the middle of the night, and like I didn't like the idea that someone else was like my schedule would be unpredictable. So then I was like, wait, I don't want to be on call because I know work-life balance is important for me. So that was the main thing that kind of drew me away from medicine, just not having the flexibility. And I have a lot of colleagues who are in medicine, and when you're in medicine, the hospitals kind of run your schedule. It's very rare that you can be like self-employed as practicing medicine. And anytime you have to go through hospital, there's so much politics involved in every aspect. And you can love what you're doing, but when someone else who's not a clinician like dictates what your schedule is and like the number of patients you're going to see, that in effect kind of leads to a poor quality of life. And that's what I've found in most of my friends who are practicing medicine, which is not the case for everyone, but that was a big draw for me towards dentistry because it's just so much more fluid. You can be a practice owner, you can work for someone, you can teach. So there's just so many different options, and you're not kind of pigeonholed into one thing. So for me, it was just maintaining a work-life balance, having a schedule, and just kind of like a little bit more freedom than as compared to working in a hospital setting.
That is very true. One more question just to wrap up. You mentioned that there's dental residencies,
Mhm.
and in medicine, we hear about fellowships. Are
Yeah.
there similar fellowships in dentistry for some
Yeah.
specialty?
Yeah, that can be very confusing. So actually, fellowship is actually the equivalent of a residency for dentistry. So it just I guess it just kind of it's just the tier, because in medicine you have to do 4 years of medical school and then 4 years of residency, and then you pick your quote unquote specialty, which is called fellowship. But with dentistry, what we bypass is like we don't have that extra 4 years of residency. So we just have the 4 years of dental school, and after 4 years you're technically a dentist, and then residency is when you specialize. So it's essentially the same thing.
Okay.
Yeah.
Yeah, that's really insightful because like translating it from one field to another might not be exact, but that does
Yeah.
clarify.
Yeah.
All right. Well, that will wrap up today's session. I do have some last reminders for our shadowers out there. So we have now posted the quiz. It's in the chat box. It's also available on our website on the virtual shadowing page. If you go onto the virtual shadowing page, there's a quiz for yesterday, our Thursday quiz, and there's our Friday quiz for Dr. Judy on the left-hand side. So scroll just a bit down on the virtual shadowing page. You'll see that button, click it, and it'll guide you to the Google form. There's 10 questions there. You have to get 6 out of the 10 correct or more in order to pass. And upon passing, you will receive a certificate to the email inbox that you list, the address that you list on the quiz. So be sure it's one you're comfortable with. Something like a personal Gmail or Yahoo account is great. Just in case you don't find the certificate in your inbox, please check your spam folder. But if you don't happen to find it in either, feel free to send us an email or a DM. We're happy to help retrieve it for you. Our email again is shadowing.h, the number 4h@gmail.com. And that quiz will be due next week, Wednesday, December 7th. So be sure to keep track of that. It's going to be due next week, Thursday, December 8th. So it's going to be due next week, just a day before like the week mark of this session here. So that's really all. Next week, we will be joined by Dr. Shaw. He's actually also a pediatric dentist. We'll see him at 7 p.m. Central on Wednesday. It's going to be Wednesday, December 7th. We made a recent schedule change with him, and we'll post his flyer soon. But just keep in mind, it's going to be Wednesday, not Monday. So Wednesday, December 7th, 7 p.m. Central as usual. And like I said at the beginning, follow us on Instagram to stay in tune with those flyers. If you'd like to stay tuned for future shadowing sessions, we have dentistry, PA, and medicine in terms of our professions. And we also have our listserv. Let us know if you have any questions. Dr. Judy has her socials here. So if you ever want to get in contact with her, feel free. Her Instagram, her YouTube, her email. We really appreciate you for sharing these. I'm sure a lot of students would like to get in touch. But yeah, that's really all. I really appreciate your time, Dr. Judy. And let's hear some thank yous in the chat for Dr. Judy as we wrap up. Hope everyone has a great rest of your weekend since it's a Friday, right?
Yes, weekend. Thank you, Michael.
Of course, of course. Hope everyone take care.